My name is Sarah Lane. I'm your host, and today we're here with Dr. J. Ames in the beautiful Puerto Vallarta city. Dr. J. Ames is a physician, and we're here to talk about the urine therapy and the urine fasting. Hi, Dr. J. Ames. How are you today?
Very well, thank you. It's a beautiful day in Puerto Vallarta.
It is. It is really beautiful. So
I understand you have a few questions you want to ask me on urine fasting and urine therapy.
Oh, definitely. Well, it sounds like a very interesting therapy. Everybody would like to know more, obviously. That's the reason we're here. What can you tell us about the urine therapy? How do you actually found out that the therapy was beneficial for human beings?
Well, I surfed the internet a lot, and I came across a bunch of websites saying urine therapy is real beneficial for health, and I thought at first that was total nonsense. But I read more, and I finally read this book, The Water of Life, and I got interested in urine therapy. So I tried it out on myself, and the first time I did it, I almost vomited because it's psychological conditioning. And then I found out that this therapy is just totally unbelievable. I use it on all of my patients today, and especially cancer patients. I've never seen anything ever as more powerful as urine therapy.
Amazing. And well, I always thought urine was a waste product. How do you actually benefit from the substance itself?
The urine does have some waste products in it, and the body will make a homeopathic substance to the waste product that it does have. Mm-hmm. However, the urine contains over 2,500 beneficial substances, and the urine has activated enzymes that your liver activates, activated minerals, hormones, amino acids, and even antigens of the person's cancer or bacteria, so the body can make a vaccine to the cancer or bacteria.
Oh, wow. How many years have you been prescribing this therapy to your patients?
I've been prescribing urine therapy for over 10 years, but in America, a doctor cannot openly prescribe urine therapy, otherwise he will lose his license.
Okay. So it can be considered as an alternative therapy, or?
Definitely. It's probably the most powerful therapy I've ever learned in my life and my medical career. It's unbelievable for infections and for cancer.
Oh, wow. And how can you talk about more? How does one drink its own urine? What is the procedure? I'm thinking there's a process, right?
Well, some people are a little timid at first. Like I mentioned, the first time I almost threw up. I said, this stuff's gross. But after fasting for a day, the urine is almost like water, and it's mainly psychological. People have had beer and wine and cheese way worse than urine. Mm-hmm. So what I have some people do is just put a teaspoon of urine in a glass of water first, then go to a tablespoon and work up slowly that way. And I have most of my patients, when they're fasting, drink a gallon of water the first day. After the first day, they don't need to drink a gallon of water because they're urinating about 400 ml of urine every 15, 20 minutes, and the urine gets so clear, it's almost like water.
Okay. Well, that's, and how, if somebody that's already taking another therapy and wants to incorporate the urine therapy, can they keep taking the prescribed drugs from the other therapy, or do you recommend them to just switch completely to the urine therapy?
They have to be really careful. If they're on an antidepressant, they can't get off that cold turkey. They might have to lower the dose in half. If they're on a blood pressure medicine, they might have to lower the dose in half. If they're on an anticoagulant, I tell them no urine therapy whatsoever because they have a potential to bleed in their brain. Their blood gets too thin. If they're on most drugs that are eliminated to the urine or even the liver and the urine, they'll have to cut down their dosage.
Oh, wow. And what can you tell us about the types of diseases that you've successfully helped others to beat using the urine therapy?
One of my patients could not afford a standard medical treatment for bladder and prostate cancer. After a 10-day fast, he was totally cured of bladder and prostate cancer according to conventional means. I've had people cured of pyelonephritis, that's an infection of the kidneys, bladder infections, dysbiosis of bacteria in the colon, small bowel overgrowth of bacteria, many diseases. Armstrong, who wrote the book, The Water of Life, actually was curing end-stage gangrene, which is totally unbelievable. Wow. Armstrong fasted for 45 days, cured himself of tuberculosis, diabetes, and obesity. The longest he had somebody fast on urine was 101 days, and this person was blind in one eye from a splinter, and his eyesight became perfect after 101 days of fasting. Amazing. Usually, after 7 days of fasting, I have people check their electrolytes, especially sodium, potassium, and chloride.
Wow. I've heard a lot about the importance of the electrolytes. What can you tell us about it and the urine therapy?
Well, when people fast, it's really important that they collect the evening urine in a glass bottle and put that on their body for 20 minutes in the morning in the shower, because otherwise they might not get enough electrolytes and they could have heart arrhythmia. So when you're older, I'm not 20 years old anymore, so when you're older, your kidneys are more likely to not absorb potassium and sodium like they did when you're 20 years old. Okay. So I might have people take a teaspoon of Himalayan salt or sea salt daily, or they might take prescription potassium. Prescription potassium is really slower in the body than potassium would get at the health food store. And I have certain values where I like to keep the electrolytes at. If your electrolytes get too low when you're fasting, you could feel wasted, feel lightheaded and wasted.
Okay. Well, that's interesting. So I have a question. I've heard people talk about urine therapy and how it is able to create stem cells. What can you tell us about it?
All you need to do is Google urine and stem cells. In China, these Chinese scientists have already grown a tooth in mice using urine. And I believe the stem cells are coming from epithelial cells from the kidney. So I believe in the future, we'll be getting all the stem cells from people's urine.
Wow, amazing. So you'll be able to, for example, I mentioned from the kidneys. So any person with a very strong renal disease or any kidney issues could benefit from urine therapy.
Oh, definitely. Also, the urine therapy and urine fasting helps increase one's hormones. In ancient China, 1,000 years ago, the emperor and the empress would have teenage boys and teenage girls pee in separate latrines. When the urine evaporated, they would get dough and roll it up. They would eat the dough, and that was the first bioidentical hormones.
Oh, wow.
So urine fasting, urine therapy has been done by yogis for centuries, Chinese. It's been done in all these countries. The problem is, it doesn't make money. So a lot of doctors and corporations are against urine therapy, but it is the most powerful therapy I've ever learned in my entire life.
Wow, that's super interesting to know. In regards of the duration of the urine therapy for a specific disease, how long does a person need to take the urine therapy for how much time?
It depends on the disease. If you have a head cold, you might want to fast for 3 days. And I also have people at the same time take Lugol's iodine, 4 drops in water a day, and vitamin C crystals, 1 teaspoon a day. The urine will knock out most diseases. However, if you have a really bad infectious disease, you can also have IV ozone or rectal ozone and also IV vitamin C at the same time you're doing urine therapy. If you're doing chelation, you don't want to do urine therapy during chelation because EDTA and DMPS, the heavy metals, are eliminated to the urine.
Okay, and also for people that are too delicate in the sense of drinking urine and they would end up throwing it up, is there a way to prepare it so that it's easier for people to drink it?
Yes, most of this is psychological, but some people are full of toxins, and some toxins will get in the urine. So the best way is to start with just a teaspoon of urine in a big glass of water, then go to 2 teaspoons and keep working up to it. And when you're fasting for a few days, you might be a little hungry, but usually your hunger is the first and second day. So if you are hungry, just drink more urine and more water. Usually the first day I have people drink a gallon of water, that much during the first day. Distilled water, actually. Okay. The second day they might only need 3/4 of a gallon because they're drinking so much urine. Sometimes I drink 2.5 liters of urine in one day when I'm fasting.
Wow. Well, that actually makes sense. And thank you for answering that question. I've heard that a lot. also, whenever the person or your patient is experiencing a darker color in the urine, whenever the urine is coming with a lot of waste, how do you do it so that it could actually be something to drink?
Even if there's blood in the urine, in dark urine, a person should drink the urine. They can also drink water to dilute it if they want to, but they have to drink urine. In Japan, medical doctors treated people with cancer with urine with a nasogastric tube. Mm-hmm. So the tube went from their nose to their stomach, and these people did not cure the cancer. So it has to hit lymph glands right here in the neck, tonsils and adenoids if you have that, to get activated. Then your body will make a vaccine. So if the urine is really dark, that usually means you're dehydrated.
Okay.
Or you have really bad kidney or liver disease. But the urine will fix the organs. The urine detoxifies the body, then fixes the body. And after day 3, the person will be making many, many stem cells, and their own stem cells.
Okay. And Dr. Jake, I have another question, and it's been requested a lot. How do you treat cancer?
That's a really good question. I've been studying cancer since high school. I used to work at the University of California, San Francisco, doing autopsies. I'm a trained pathologist and internist. And I found that the main treatment to treat cancer and even cure cancer is urine fasting. There is no treatment on earth better than urine fasting to treat and cure cancer. After that, I use what's called the CC cream. It's a cream that kills all anaerobic bacteria, fungi, and all cancer cells anywhere in the body. I can give the link to this later. Then I have people on a diet that consists of 80% fat, 5% carbohydrates, 15% protein. Atkins was real disappointed. His Atkins diet did not treat or cure cancer. It helped really well with obesity, diabetes, and other diseases. But cancer, besides growing on carbohydrates, can grow with excess protein. Mm-hmm. So this diet has a ratio of 1 part protein, 3.5 parts fat, 0.3 carbohydrate, and most of the fat is olive oil. Almost all of my patients will ingest 500 ml of real olive oil weekly. They also use coconut oil and also ghee derived from cows that were grass-fed.
Mm-hmm. Mm-hmm. Oh, that's amazing, Dr. Jake. I've heard a little bit about the CC cream, which others call the CC treatment. So be sure to leave some information extra for you in the links. What would be one of the books that you would recommend for people that are new to urine therapy or people that need to, get into detail about this therapy that will allow them to have a little bit more confidence to start the treatment?
The number 1 book to read is The Water of Life by John Armstrong. I've read this book 6 times already and totally blown away what urine can do. After that, I would read Your Own Perfect Medicine by Martha Christie. Mm-hmm. The Golden Fountain by Cohen Vanderkroon, and another book called Shivambu Kalpa. The first 3 books are in PDF format, so they're free. The other book, you'd have to get used. But these are my 4 favorite books on urine therapy.
Amazing. And is there any book that goes by the hand of that? I remember you talk a little bit about the importance of nutrition and what people eat. And a lot of doctors lately, especially holistic doctors, are saying that everything starts from a good diet. What would be a good book for people to read about it?
Well, there's a few books, Sarah. I like Dr. Stephen Gundry's book, The Plant Paradox, because a lot of us have too many lectins. Dr. Jan Kwasniewski has a book called Homo Optimus, which is a free book now. I paid $80 for this book from Poland. You can read Mercola's book called Fat for Fuel. Mm-hmm. And basically, when people have cancer, they need to be on a certain type of ketogenic diet, but the ketogenic diet is almost impossible for people to stay on long term. But if someone has type 2 diabetes or a really terrible disease or cancer, they need to be on this until they're through with their disease.
Okay, well, that's very interesting as well. So Dr. Jake, last question, and I'm sure you get answered this a lot. Once a person begins the urine therapy, are there any side effects related to this therapy?
Yes, if one has parasites or yeast or fungus in the colon, or dysbiosis, which means bad bacteria in the colon, they will have diarrhea. It could be 1 to 3 days. Mm-hmm. That's usually no problem. It's not infectious diarrhea. They may go through a Herxheimer reaction. That's where people might have a flu-like reaction. That can pass. Sometimes they might feel wasted, and sometimes all they need are to take electrolytes like sea salt, Himalayan salt, or prescription potassium to get their electrolytes at an optimal level, and that'll pass. The hardest thing about urine therapy, it's boring. Usually people miss eating lunch, they miss eating dinner, and usually myself, I just make sure I'm reading the book or listening to music. And after a while, after a few days, people get used to fasting, and there's no hunger usually after a few days. There might be psychological hunger or a habit of eating, but the physical hunger pains usually go away in 1 to 2 days.
Mm-hmm. Amazing. Well, it was a pleasure to be with you today. Remember, Dr. G. Ames has his office in Puerto Vallarta. Very beautiful down here. You guys should come visit. Also, his website, www.jamesmd.com. I'm sure you want to add something more, Jake?
Yes, we're not done yet. The ladies in the audience, I want to mention almost every female Mexican patient that I have puts urine on their face at night. They pee in a washcloth, they dab their face and neck with urine, and this is what the movie stars have been doing for decades. The urine has allantoin, urea, all kinds of vitamins, hormones, minerals, amino acids, and this is one way, ladies, that you can keep young and beautiful by putting urine on your face and also doing episodic fasting. So there's a book by Professor Longo called The Longevity Diet. And after 3 to 5 days just on a water fast, which is way inferior to urine fast, your body really gears up stem cells. Mm-hmm. The urine will actually grow back telomeres. That's an anti-aging process. So if you want to stay young and healthy, at least drink 1 glass of urine a day. The first morning urine is the strongest, but that has melatonin, a lot of growth hormone, and other substances. But you can drink urine all day even if you're not fasting. So this is something that I'd like all of you to do a lot of research on this and really learn about it, because it is the most important thing I've ever learned in my life and my medical career. And it is the closest we have to a fountain of youth treatment.